How does Wilson's disease affect copper metabolism? Have you ever wondered how our bodies handle copper? In Wilson's disease, this process goes awry due to a genetic mutation. Specifically, Wilson's disease is caused by changes in the ATP7B gene. This gene is crucial because it produces a protein that helps manage copper levels in the liver. Normally, when we consume copper, it travels to the liver, where this protein plays a vital role in processing and excreting excess copper. In a healthy body, copper is incorporated into a protein called ceruloplasmin. This protein then carries copper through the bloodstream and helps eliminate any extra copper through bile. However, in Wilson's disease, the ATP7B protein is defective. This means that the liver cells, known as hepatocytes, cannot effectively process and excrete copper. As a result, copper starts to build up in the liver and can cause significant damage. This accumulation of copper leads to oxidative stress, which means that harmful reactive oxygen species are generated. These substances can injure liver cells, leading to inflammation and even fibrosis, which is the thickening and scarring of liver tissue. If left untreated, this can progress to cirrhosis, a severe condition that can increase the risk of liver cancer. Interestingly, while the uptake of copper from the intestine remains normal, the liver's inability to manage it properly is what causes the problems. Because the ATP7B protein is not functioning correctly, the liver cannot incorporate copper into ceruloplasmin effectively. This results in low levels of this important protein in the blood and high levels of free copper, which is toxic to cells. The excess copper does not just stay in the liver. It can spill over into the bloodstream and deposit in other organs, including the brain, kidneys, and even the eyes. This can lead to a range of neurological and systemic symptoms, making Wilson's disease a multifaceted condition. One interesting diagnostic marker for Wilson's disease is the increased amount of copper in urine. This happens because the body tries to eliminate the excess copper that the liver cannot process. Understanding how copper metabolism is disrupted in Wilson's disease is essential for effective management. Treatments often focus on reducing copper levels in the body through medications that help remove copper and dietary restrictions to limit copper intake. In summary, Wilson's disease disrupts copper metabolism by impairing the ATP7B protein's ability to manage copper. This leads to toxic copper accumulation in the liver and other organs, resulting in significant health risks, including liver damage and an increased chance of liver cancer. If you suspect you have Wilson's disease or have concerns about copper metabolism, it is crucial to consult a healthcare professional for personalized advice and management.